what we're going to be going through is what advanced care planning is, why it's important, and who can create one. The preparation hints and tips, the documentation, which sometimes can be a little bit overwhelming, which is why we're running this session, and then we will have time at the end for the questions. So please, I'll reiterate to write down what your questions are as you go, unless you've got a super memory. Vic's consumer advocate will be taking us through what advanced care planning is, why it's important, and who can create one. As part of this, Sue will be providing insights of her first-hand experiences with advanced care planning, and apologies for that. Catherine, who is also a Vic's consumer advocate, will talk to us on preparation for completing an advanced care planning, including those hints and tips which are written up there. She will also provide insights on choosing a substitute decision maker, as well as other important considerations. Then you will hear from Kylie from Advanced Care Planning Australia, who will run through some of the forms and documents you will encounter and help us navigate those a little bit easier. Then, if all's going well and I keep on time, we should have 20 minutes or close to 20 minutes at the end for questions. Next slide, thank you, James. I'm now going to introduce Kylie Ash. Kylie is joining us today. Let's see if we can see her on camera. Kylie is joining us today from windswept but sunny Queensland and is the Education Coordinator for Advanced Care Planning Australia. Kylie is a registered nurse with a Master of Nursing. Her clinical grounding in cancer and haematological settings forged her passion for holistic person-led care. Kylie has an extensive history managing and contributing to cancer and palliative care workforce development projects nationally, and in her current role, she is driven to deliver engaging and innovative learning to care providers in the community to support advanced care planning in Australia. Thank you, Kylie. Hand over to you. Next slide. Thanks, James.
Thanks so much for that introduction, and hello and happy Advanced Care Planning Week, everyone. Thank you very much for having me here today. As noted, I'm coming from Brisbane Meanjin today, unceded lands of the Turrbal and Yugara peoples. So at this point, just thought we might clarify what advanced care planning is and what it isn't. While both advanced care planning and voluntary assisted dying may involve a person's choices regarding medical treatment and care, they are quite different. So voluntary assisted dying, often referred to as VAD, involves a person in the late stages of advanced disease taking a substance prescribed by a doctor that will bring about their death at a time that they choose. VAD may be an option for people who satisfy legal eligibility criteria, but it can only be accessed by a person who can make and communicate decisions. The points that you can see on your screen refer to advanced care planning. It is predominantly about having detailed conversations, considering future health care. Advanced care planning allows a person to share and record their wishes so that a substitute decision maker and healthcare providers can honour those preferences if the person can no longer make or communicate these decisions. And really, at the heart of it, the goal of advanced care planning is to align treatment that a person receives with their preferences for care. So thank you. Just a short overview and update. Next slide.
Thank you, Kylie, for that simple explanation, as I know that there can sometimes be confusion around both terms. Before we get started, to give you a quick overview of the two organisations hosting today's webinar. So as you would be aware, we have Advanced Care Planning Australia, which is a federally funded program operating as the national voice of advanced care planning. The program offers community advice and support on advanced care planning all through Australia, along with health professional training and education programs. At a systems level, they drive policy, advocacy and research activities in this space. The Victorian Integrated Cancer Services, or VICS, are the Cancer Service Improvement Network across Victoria and comprises of 5 regional, 3 metropolitan and 1 statewide paediatric integrated cancer service. Within the VICS, we have several state-based special interest peer groups, and it was through the VICS Consumer Peer Engagement Group that this event came about. In 2024, there was strong interest from the consumers in having an event focused on education around advanced care planning. Therefore, VICS worked with this small group of VICS consumers to design today's session, and we are thrilled to have 2 VICS consumer advocates, along with Kylie Ash from Advanced Care Planning, joining us today to share their knowledge. I'm going to introduce Sue Matthews to you. Thanks, James. Sue joins us today in the capacity of a VICS consumer advocate, and she also volunteers with Palliative Care Victoria. Sue started her career as a registered nurse midwife and then completed a psychology degree. From her own personal experience, Sue learnt the importance of knowing someone's wishes at the end of their life, and then for the last 8 years since retiring, has been passionate about educating and supporting community members in understanding the importance of advanced care planning. In her spare time, Sue loves to do papercraft, spend time with her dog, as well as gardening. Thank you, Sue. I'll hand over to you.
Thank you. First slide, thanks, James. Okay, so what is advanced care planning? Advanced care planning is about preparing yourself and your loved ones for any future situation where you're unable to make your own medical decisions. And this could be due to an accident, dementia, or any other serious illness where you're unable to speak for yourself. And it's also about giving yourself the ability to have a say in your care and treatment when you're unable to speak for yourself. Statistics show that 50% of us will be unable to make our own end-of-life decisions. Next slide, thanks, James. The advanced care planning is 4 steps. And the first is about identifying your own values and beliefs and where your bottom line is. Values and beliefs can be a bit of an overwhelming terminology for people, but really it's about thinking about what's important for you and what makes a good day for you. What makes your life worthwhile? What are the things you couldn't live without? For example, being able to communicate with your family in a meaningful way, being able to read, being able to live independently, or the ability to enjoy your hobbies. This step can take some time and a lot of soul searching, and Catherine will talk more about that shortly. So once you've done your soul searching and know where your bottom line, your line in the sand is, it's time to move on to the next step, and that's to communicate. The second step involves communicating your wishes to your family, loved ones, and medical team. Tell them what's important to you and why, so they have a full understanding of what's important to you. Communicating with your loved ones is one of the most important steps. Step 3, choosing a substitute decision maker, or as it's known in Victoria, a medical treatment decision maker. This is the person who knows and understands what's important to you and is willing to advocate on your behalf. If you're unable to communicate your wishes yourself, this is the person you need to have the most important conversations with. And Catherine will speak shortly about choosing your medical treatment decision maker. And finally, the fourth step is about writing it down into an advanced care directive. And we'll speak for, Kylie will speak more about that later on. Next slide, thanks, James. So why is advanced care planning important? I'm going to share with you a very personal story about my brother Dennis. He passed away 2 years ago. Fortunately, Dennis had followed the first 3 steps of advanced care planning. He was diagnosed with non-Hodgkin's cancer at 38. He went through chemotherapy and went into remission, which lasted for 16 years, where his cancer came back. He again went through chemotherapy and went into remission. However, as a result of his second chemotherapy, he developed cardiomyopathy, which led to heart failure, leaving him with 20% heart function. He had a pacemaker and a defibrillator inserted, and this allowed him to live independently and do the things he enjoyed for a further 6 years. He was an enthusiastic vintage motorbike collector and rider. He had 4 very special vintage motorbikes that he had restored and treated like babies. He'd also won many prizes for his motorbikes. 2 years ago, his defibrillator started going off on a regular basis, and his ability to breathe became difficult. His condition deteriorated rapidly, and by the time I got to see him, he was on a ventilator and heavily sedated. He was being defibrillated up to 10 times a day as his heart continued to go into a dangerous heart rhythm, which could result in death. The doctors decided to do experimental surgery on him that they believed would stop the irregular heartbeat. My brother had previously signed an authority for this operation, so we proceeded. The first operation was unsuccessful due to adhesions, and as Dennis had originally signed for the first operation, I gave my permission for the second, which was scheduled a week later. This operation also failed. And previously to this, my brother and I had had many in-depth conversations about what his beliefs and values were and what was important to him. He was very clear that if he could not live independently and enjoy his hobbies and motorbikes, he could not see any value in living. We discussed his funeral and where he wanted to be buried. And he also officially appointed me as his medical treatment decision maker. Following his second operation, he remained on a ventilator and his heart continued to go into a dangerous heart rhythm, and he continued to be defibrillated regularly. At this stage, he had been unconscious and on a ventilator for 6 weeks. He'd also developed paralysis from the neck down due to the stress on his body. The doctors wished to do a tracheotomy, which is put a tube into his throat so that he could breathe without the ventilator. At this stage, my other siblings were involved with me in making medical decisions for him. They also firmly believed he should be kept alive despite being paralysed from the neck down, still only having 20% heart function and requiring regular defibrillation. He would not be able to feed himself, speak, or do anything for himself, with very little prospect of things improving. As Dennis and I had had those important conversations and completed the first 3 steps of advanced care planning, I was aware what was important to him and what he would want in certain circumstances. I was also appointed as his official medical treatment decision maker. Therefore, I had the final say. If he had not appointed me officially according to the hierarchy, which we'll explain later, my older brother would have been his medical treatment decision maker, and his outcome would have been very different, as he'd never had any conversation with Dennis regarding treatments and end-of-life care. I relayed the conversations that I had with Dennis to my family and explained that he was not able to do the basic things in life, which were important to him, he would not want to live. I had to make the difficult decision of turning off his ventilator and allowing him to pass peacefully. If we had not had those in-depth conversations, it would have been much more difficult for me to make the decision. Even though it was still a very difficult decision to make to let him pass peacefully, I know it was the right one for him, and we were able to be with him. So you can see why these conversations are so important to have about advanced care planning. If you don't have these conversations, it will be very difficult for your loved ones to make very difficult decisions, and they will rely on their own beliefs and values. And no one really knows what you want unless you tell them. And if you do not tell them, you'll be subject to their own biases, as was with the case with Dennis. Next slide. Thanks, James. So as you can see from my story, there are many benefits of advanced care planning, particularly those important conversations. Oh, we've skipped a slide, I think. That's okay. No. So who can do advanced care planning? Anyone over the age of 18 and who has what we call capacity. It is even more important for people who, as they're getting older, because eventually we're all going to pass, anyone who has a chronic illness or multiple diseases, anyone who has early cognitive impaired, it's important that they start thinking about advanced care planning. And anyone who has particular religious or spiritual, cultural or value-based wishes and preferences, it's important that you discuss those with your family and that you put them in an advanced care plan. Or I think Carly will talk to you more at the end of this session about capacity. But your doctor must sign an advanced care directive to verify that you fully understand and what you've written about to ensure that you have capacity. Therefore, the time to do advanced care planning is now while you have capacity. Next slide.
Sue, thank you so much for sharing your story. But through that, we've learnt a lot already about advanced care planning. And while I've been familiar with advanced care planning over the years, this has revisited some of those key messages. And for me, who has a very elderly mother in her mid-90s, communication is just so important. But with her particularly, we've revisited this a couple of times as she's got closer to a different stage in her life. So the things that I took away was communication, and also for timing. So thank you very much. Now we're going to move on to Catherine, who is a consumer advocate for the Victorian Integrated Cancer Services, which you'll hear a fair bit about over the next hour or so. Catherine joins us today in that capacity, and Catherine's nursing background made her aware of the difficulties that many people experience in navigating a very complex health system, in understanding their own health, and also in choosing the kind of medical treatment that they want to receive. Over the past 14 years, Catherine has been involved in a volunteer capacity in delivering advanced care planning education sessions and taking calls to their National Telephone Advisory Service. Currently, Catherine is a volunteer community educator with Palliative Care Victoria. Catherine has a love for history, travelling and watching documentaries. Catherine's husband is a fanatical football follower, but she has made very clear that she is not. So I'm going to hand over to Catherine. Thank you.
Good. Next slide. Thanks, James. Right. Thanks, Jane. Thanks, Sue. Well, as Sue told us very clearly, the centre of advanced care planning is the conversation. These are focused discussions over time to let others know what's important to you and what you value. It provides a guiding framework for the substitute decision maker around which decisions about your medical care might need to be made in the future. Your conversation isn't especially about specific treatments. It can be, but it doesn't have to be. It's more about your attitude to medical care in the future. Length of life versus quality of life, for example. What you regard as an acceptable or an unacceptable quality of life for yourself. And finding the right words to explain this to other people is essential. These conversations are also important in informing the basis of future decisions with your health professionals around appropriate treatments to be given to you at the time when they're indicated. These conversations can't be rushed. So you need to do them, as Sue was alluded to, capacity. You need to do it while you've got the capacity to have the time for considered decision making. Don't rush them. These are too important. So you prepare yourself first before you talk to other people, and just get your own thoughts a little bit clarified first. And you need to be comfortable with what you're thinking before talking with other family and friends. Essentials for you are to have a good understanding of your current health, and that's the basis of good decision making for yourself in the future. Talk with your GP and specialist. Don't be afraid to ask questions and have them answered in a way that you can understand. For example, do you understand how your health is likely to progress in the future? How much do you and your decision maker and your family and friends know about what's meant by life-prolonging treatments? What are they? What do they involve? Are they going to be relevant to you or not? Now, I can recommend to you, there's an excellent document on the Advanced Care Planning Australia website, just called Life Prolonging Treatments. You can just put that Life Prolonging Treatments into the search bar, and it explains what they're intended to do, when they can help you and when they can't, and it goes through all the different common life-prolonging treatments. And I feel that's essential reading for every one of us, and particularly for your decision maker and your family as well. And also, do you understand how palliative care can help you live your best quality of life when you have a life-limiting condition? And talk to anybody else that you think might be helpful in talking through your ideas with, or clarifying some of the things you're thinking about as well. So next slide. Thanks, James. Okay, so you've done your own preparation, you've clarified some of your own ideas as well. Then start talking to your substitute decision maker and other close family or friends who can provide a positive support for your decision maker when they're acting in that role for you. You're asking that your values and care preferences are understood and respected. Every one of us doesn't think the same, and that's okay, but this is about you and what's important to you. These are important conversations that you need to have. Families may say that they know what you'd want, but in reality, if it hasn't been spoken about, they're only guessing. And the stress of relying on guessing when decisions need to be made can be really stressful and overwhelming and give rise to uncertainty that never goes away and can't be resolved. Tell them what matters to you. Do you want to live as long as possible, or so long as your quality of life is okay to you? What would a good quality of life look like to you? And what would not living well look like to you as well? What's your attitude to future admissions to hospital? Does it depend on a recovery that's acceptable to you? And if that's unlikely, would you rather stay in your home or your care facility and be looked after there? Do you have a special place of care where you want to be, or a place of dying? Both of those things are really important to discuss with your family. Or is it just no particular place, but accept the place where you need to be to get the care you need to keep you comfortable? Do you have any bucket list items, places to go, things to do, special events to attend? They're important to let people know as well. If you become really unwell, are there particular or family or friends that you want to have close to you? Are there particular family and friends you wouldn't want to have close to you? That's equally important. Are there special things that you want to have around you, like pets, photos, mementos of any sort, anything that is special to you? For cultural traditions or religious or spiritual practices, make sure your family are aware that these are important to you as well. And talk about anything else that you think is important that they need to know. Thanks, James. Okay, now we go over to the role of the substitute decision maker, which is prescribed for us in our in the advanced care planning legislation in Victoria. And as Sue said, your substitute decision maker is called a medical treatment decision maker in Victoria. Now, your medical treatment decision maker is someone recognised by law as having authority to make decisions about your medical care when you can't make those decisions for yourself. And while you can, you simply keep on making your own decisions for as long as you can. You can formally appoint your medical treatment decision maker. It's the only appointment that specifically authorises another trusted person to make medical treatment decisions on your behalf. Appointing a substitute decision maker or appointing a medical treatment decision maker in Victoria is not the same as other powers of attorney, and we find that there's a lot of confusion about that. So the role of your substitute decision maker or your medical treatment decision maker is prescribed under our advanced care planning laws. They can only make healthcare decisions for you if you become unable to make or communicate decisions yourself. They can consent to treat or refuse treatment or withdraw treatment on your behalf. They have the same authority that each of us has currently. And they must make the decisions that they believe you would have made yourself. Not a decision that they think is a good decision, but the decision that they believe you would have made yourself. Thanks, James. How do you go about choosing this important person? Your substitute decision maker can be asked to make some quite significant decisions that have a big impact on you. In our healthcare system, they're often around life-prolonging treatments. Do you want them or not? It might be the difference between consenting to a treatment where you're expected to make a recovery that's acceptable to you, or refusing a treatment where you're not expected to recover to live a quality of life that would be acceptable to you. Take the time to choose your substitute decision maker carefully, and you can appoint a family member or a friend. You can appoint the person of your own choosing. So they need to be above everything else, someone that you trust, because you're asking them to advocate for you and to respect your wishes. They need to be easily accessible, easily contactable, over the age of 18 as well, and able to make complex medical decisions in potentially stressful situations, and also to be a good communicator within your family group and between you, your family group and the medical staff as well. So you need to make sure that The person you choose is not someone that you merely have a good, that you love dearly, but they need to be able to execute the role you're asking for them to do very well for you. And they need to, it goes without saying really, that they need to know your preferences and what's important to you. And you can choose and appoint the person that you want, or else a substitute decision maker will be identified for you from within the Victorian Advanced Care Planning legislation. Thanks, James. Now, there are people come across, there are lots of problems that people encounter for a whole range of different reasons when they're trying to undertake advanced care planning for themselves. But for people from different cultural backgrounds, there are some extra problems that it might be helpful to be aware of. So there might be some extra considerations when engaging with people from different cultural backgrounds in the benefits of advanced care planning for themselves and their families. Language can be a huge barrier to people when dealing with the healthcare system and engaging with the advanced care planning process. Our advanced care planning documents must be written in English by the person themselves. Nobody else can write it for them. This highlights the value of a standalone conversations about care preferences if an English language document is not going to be possible or be extremely difficult. There are also different cultural, religious or spiritual beliefs around death and dying that can make people reluctant to engage with the advanced care planning process as well. And there's certainly a role for cultural advisors to help bridge that gap in understanding. It's important to not assume that everybody from a particular cultural group holds a particular view. They don't. They're all individuals and they need to be treated as individuals. Ask them what's important to you. How do you like decisions made? Now, the decision-making process ourselves, it's in our Western cultural values the role of the individual and places great emphasis on personal autonomy, the right to make our own decisions. Other cultures might have different values and different ways of making decisions. Ask them. Some cultural groups prefer family or family eldest or a religious or a cultural or clan leader to make decisions for them. They're allowed to be different. Just ask them, what's the way that you want decisions made? And the notion of formally giving a power of attorney like a medical treatment decision maker authority to another individual is unknown in many other cultures. Don't assume, just ask the person how they want decisions made and by whom. Trust in government or health bureaucracies in other cultures is low for lots of different reasons, and it can translate into reluctance to be involved in the advanced care planning process. And poor education background and low health literacy can affect anyone, not just people from cultural backgrounds, and makes it more difficult to grasp the concepts of advanced care planning. Whatever the barriers, we need to find a way for everyone wanting a voice to have a voice and be heard. It's your choice. Advanced care planning provides a benefit to the person and their family, and advanced care planning is for everyone. Thanks, James.
Fantastic. Thank you so much, Catherine. So we've just heard about the what is advanced care planning, the why, and there's no greater power than through the power of a personal story. So thank you again to Sue for sharing that. We've also heard about some of the how. So we're now going to cross over to Kylie, who will expand on the how and some of the different elements as well. So Kylie, as introduced before, is from Advanced Care Planning Australia. Thank you.
Thanks so much. Whilst I'm going to talk about the documents, I thought it would be good just at this point to reinforce just how important and at the core of advanced care planning conversations are, and that's really been reiterated by Catherine just then. But initiating these conversations isn't always easy. So I just thought it'd be good to highlight some free Australian resources that can help you talk to your loved ones and perhaps consider those important questions and choices that may not have occurred to you, so that you can really create that picture of what quality of life means to you. The conversation starter card, which is on the screen, can assist you to find some of those words to describe what's important. It may help with some conversations with family, friends, and health and aged care providers. And these are available for download off the Advanced Care Planning website. There's also Palliative Care Australia have discussion starters. This is a set of workbooks and also cards that can support individual or group reflection. And there are also sets specifically developed for older people and Aboriginal and Torres Strait Islander people, also available to be ordered from the Palliative Care Australia website for free. My Values is an online resource, and you can create a values profile report by completing a number of quizzes in relation to life, death, and medical interventions, and you can then create and have that report as a hard copy. Thank you. Next slide. So if you do wish to document those wishes and preferences in an advanced care directive, we would recommend that you do use the Victorian Advanced Care Directive for Adults form. There is quite a detailed instruction guide available online, which is available to help you complete the form. And if you do need someone's help, though, to complete and sign the document for you, due to a physical disability affecting writing or signing, there is a specific form for that purpose, the Advanced Care Directive for Adults, for someone signing on your behalf. And both forms include the same sections that you can see on the slide there. Part 1 really is an introduction and includes your personal details and any major health problems that you have currently. Next slide, and I'll take you through parts 2 and 3. There are images on the screen there you can see of the documents, just screen grabs. Part 2, as we've noted, is the most important aspect of the document. It's often difficult to make those definitive decisions about uncertain future health scenarios. And so this is why really spending time reflecting on your values and preferences and discussing these with your medical treatment decision maker so they have that really clear picture of what quality of life means to you is so important. And that was the example that Sue really expressed by sharing her story. Your medical treatment decision maker is legally required to first consider your values directive when they make decisions about your medical treatment. So you may complete all, some, or none of the sections in part 2. I think that's also very important to note. Part 3 is the instructional directive, also not compulsory to complete. The instructional directive is legally binding and communicates your medical treatment decisions directly to your health practitioner. It is recommended that you do consult a medical practitioner if you choose to complete this instructional directive. And Catherine really talked through some of the thinking behind coming to decisions to put into this instructional directives. And so talking to your healthcare team, you can understand your future health conditions that you may experience. They may also discuss treatment options you may have in the future, and perhaps some of the decisions you may need to make and any consequences of those decisions. Also really important is that you should include details about the circumstances in which you consent to or refuse treatment, because that is really important when these documents are being enacted. Next slide. The form also includes an option to include an expiry date. There are specific signatory requirements that you should be aware of. You must sign in front of 2 adult witnesses, and 1 witness must be a registered medical practitioner. And neither witness can be a person that you have appointed as your medical treatment decision maker. If an interpreter is present at the time that the document is witnessed, there are spaces for them to complete a statement and sign in parts 5 and 6. Next slide, please. A valid refusal of medical treatment certificate is another alternative documentation that is recognised if that was made prior to the 12th of March 2018, if it has been signed by a doctor and it is still clinically relevant. And I think that's a timely note also to acknowledge that these documents can and should be reviewed every year or two. And also, certainly, if your circumstances have changed, we certainly recommend that you do review and can update them. And whilst we recommend that advanced care planning conversations happen early, we also acknowledge that there are times when others may need to be involved in advanced care planning on behalf of someone that they love. So I think, Sue, you mentioned earlier around capacity and what that means. And really, when we're talking about advanced care planning, the common law or advanced care directives are only able to be completed by someone if they actually have capacity. And when we're looking at that decision making, they have to be competent or have decision making capacity. And an adult is presumed to have decision making capacity unless there is evidence to the contrary. And I will also note there's a couple points that are components of decision-making capacity. It is task-specific. A person has to have the ability to understand information. They have to be able to appreciate the relevance of that information to the situation and have the ability to reason and weigh up the risks and benefits of the situation, and also then be able to express a choice and make that decision. So just wanted to acknowledge that. So if it is deemed that someone does not have decision-making capacity, a family member or a healthcare professional can document their preferences around and their values and medical treatment preferences on the person's behalf using a form, what I understand to be the person's preferences and values form. And whilst this document isn't legally binding, it can be very useful to inform care decisions and should be taken into account. Next slide. Now, Catherine did really give a really clear overview in terms of the substitute decision makers in Victoria. So I'll just make a couple brief points. In Victoria, while you can appoint multiple substitute decision makers, only one person can actually be identified as the medical treatment decision maker on a particular occasion. And there are the specific documents, as you can see on the screen, to complete those tasks. And there is an online checklist, which is really worthwhile to access, which you can actually access to complete the task. And similarly to the Advanced Care Directive document, there is another document available if you require assistance to complete and sign the document on your behalf. These forms also have very specific requirements for completion and witnessing, and your chosen medical treatment decision maker must accept this role by signing the form. And if you do create a new document, it automatically revokes any previous one. So just something to be mindful of, that you should always share with other people if you do update your documents. Next slide, please. So when a person is unable to make or communicate their decisions, there is a hierarchy, as Catherine indicated, around determining who that person is, who is the medical treatment decision maker. And it is the first available and willing person from the numbered list on your screen. And as you can see, that's why really appointing someone puts that person at the top of that list. So it's very important to go through that thinking that Catherine talked about to appoint your medical treatment decision maker. Alternative, some individuals may have a guardian appointed, but if no one has been appointed, the list on your screen shows the identified first person list who has a close and continuing relationship with that person. And as Sue really indicated, it really is important to understand the implications of that list and if the person at the top of that list is who you'd like to speak on your behalf. Next slide, please. So in terms of completing these documents, there are just a couple points I thought I would make around these. As Catherine indicated, they must be in English. And just to remember that the values directives speak directly to your substitute decision maker, and the instructional directives are legally binding and speak to your healthcare provider about the treatments that you consent to or refuse. If any of your statements that you've documented are unclear or uncertain or not applicable in that specific circumstance that you may find yourself in, it will become a values directive. And whilst that's still meaningful, it's not legally binding. We've talked through capacity, and that is one that you must have capacity at the time that you complete your advanced care directive and or appoint your medical treatment decision maker. And it's really good to be very clear about the signing requirements for the documents so that they are valid. Thanks. Next slide. So you've gone to all this difficult, hard work to actually complete these documents. So let's make sure that they're accessible and available if and when the time comes. So after creating the documents, you should share copies with your substitute decision maker, family, friends, carers, and your healthcare team. And this will really ensure that everyone knows what you want and documents are available when they're needed. We also recommend uploading your documents to the My Health record. Having a wallet card can also help you quickly identify your medical treatment decision maker and the location of any advanced care planning documents. James, if you just click the slide again, you'll be able to see that on your screen. And these are available for download from the Advanced Care Planning Australia website, or we can post you one of these if you call the National Advisory Line. Just a really good thing to pop in your wallet. Thanks. Next slide. So if you'd like any further information, you can access, I think there's a couple of times the Advanced Care Planning Australia website's been referred to. We also have the National Advisory Line that you can call. That is a line for community members as well as health professionals. And there's also a link there for some of the education resources that we have on availability for health professionals. So thank you very much for your time and for Vix for inviting me. Cheers.